Live from Times Square, it's Pop Recovery Systems, led by visionary Laura Alexis. Pop Recovery Systems, redefining surgical recovery, with bariatric expert Dr. Eric Smith. Innovating surgical preparation and recovery, Pop Recovery Systems blends nutrition, mental health, and wellness.
Breaking through the noise and changing an industry. Join Laura Alexis and Dr. Eric Smith on the Pop Culture Podcast.
Hi, this is Laura Alexis.
And I'm Dr. Eric Smith.
And this is
the Pop Culture Podcast.
Yay! We're so excited to be here. On this episode, we have the beautiful Maddie Allen. Maddie, thank you so much for joining us tonight.
Thank you so much for having me. This is such an honor.
What's up, Maddie?
How are you?
I'm good. How are you? It's been a long time.
It's been a long time. I think I haven't seen you since Portland.
That's exactly when I saw you. Yes.
Yep.
Yeah,
what happened in
cool.
Portland?
That was the award show, the first one.
Yeah, the first Just Be You Bariatric Awards.
Okay. Got it. Well, Maddie, we're so honored to be here with you today. We're going to be learning about your health journey here on the Pop Culture Podcast. We like to talk about all things health and wellness, things that are trending, things that are going on that we have questions about. And of course, that's why we had to bring in Dr. Eric Smith so that we can get an inside scoop on some of these subjects.
That sounds great.
So I wanted to talk about, Maddie, one of the reasons I wanted you on the show is during your health journey, I know, and I'm not sure if some of the listeners know you. I know that you're very popular on social media, so I'm sure that some of your fans will be tuning in. But could you tell us a little bit about your health journey from obesity to wellness? We're going to get into the one subject that we're going to get into, but I'd love to kind of intro into that.
Yeah, absolutely. So my name is Maddie. I am from Ohio, and I was first diagnosed with obesity when I was 6 years old. And it followed me my entire life, all through high school, all through college. I did a ton of crash diets, crazy, just anything you could think of, liquid diets, physician monitored diets, anything you can think of, I did it. And I became a nurse in 2013. And in 2016, I was at the Cleveland baseball game with my mom at the playoff game. And I went to sit in the seat and I almost could not fit in the seat. And I thought to myself, I just turned 28 years old. Like, if I don't do something, my parents are going to bury me. I didn't know, but I kept thinking, like, my parents are going to have to bury me. That's not the way that things are supposed to go. And the next day after that baseball game, I called a bariatric surgeon and set up a consultation just to see what it was about. I remember thinking, that's not for me. Like, I am only 338 pounds. Like, I don't think I need something that extreme. And so I had gastric bypass surgery in June of 2017, and it will forever be one of the best decisions of my entire life. It was not an easy road right after surgery. I had a few complications. And so I'm 7.5 years post-op. I've kept off 170 pounds. And in the height of COVID, it was right before COVID, I had a health problem. And so I went part-time as a nurse and decided to start my blog, Maddie5088.com. And I shared things on Instagram and Facebook and then started on TikTok. And it was just a way for me to share with people that if they were in that same situation that I was in and couldn't fit in that stadium seat, that theater seat, run around with their kids, I wanted people to know that there was another option and that it had worked for me and it was working for so many other people. And that was when I started, sharing my story online with thousands of people in 2020. And that is still something that I do today, but I did have some health issues that knocked the wind out of my sails for a good year. So that's a little bit about me.
Maddie, I have to say that when I first kind of got involved on social media reluctantly. For those that know me well, know it was very reluctant. You may not know it now, but you were one of the first accounts that I got introduced to. Monica, who I work with to help me with my social media, she was like, she's trying to get me to realize what a community there was out there. And you were one of the first accounts that I saw. And so just kind of following along, it really showed me right away how many people out there were willing to be vulnerable and not just show really pretty before and after pictures and look at all the weight that I've lost, but the good days and the bad days and in between. And obviously I've met a ton of people since then who have shared their stories too. But it was so eye-opening of the resources that our patients could have. And you were one of the first people that I would tell patients, hey, follow this person, because we never wanted to paint this picture that it was perfect, right? Life isn't perfect, and we're going to talk about that tonight. But it was a great example of the honesty and the vulnerability of your journey that you still, after the fact, look back and say, it changed my life for the better.
Yeah. And I would do it a million times over. And I would share my story a million times over because, and I truly, what we talk about later and the struggles that I had, I truly never think that I go through something for no reason. Like, I truly think I'm a believer of Jesus, and I think Jesus puts it on my plate to handle and then help others with it. I truly think that is why I haven't had the easiest road, but it's still a road that I'd go back down a million times because my life is just so much more full and happy. I can go out for long walks and not be worried about dripping sweat. There's just endless things, as you know. There's so many benefits that have come from it, but it's not easy and it's hard. And I remember one of the first posts that I got really vulnerable with was talking about how, when I first became a nurse and I was very stressed out, I ate food out of my family's trash can because I got home and I saw there was a pizza box in the bottom, and I got in there and got crust out and I needed to numb the pain that I was feeling. And that was how I did it. And I just knew something had to change. And once I figured it out, I was like, I want to share this with people.
Wow. That is so I have never seen that post, but that just shows how brave you are and courageous and how you were literally at the bottom of at the bottom of the trash can. And you used those, so many people can go through bottom moments, but then they make excuses to kind of stay there. And I love how you have used that as the reason, you created that into motivation. And I do want to jump into kind of what happened in 2020, because one thing that I had heard as I started to get more into the various communities was how people would try to blame different complications or health problems on bariatric surgery. And you went through that in a very deep way, right?
Yeah. So it was at the very first retreat, which was in October of 2021. I remember it started in 2020. I was having really loose stools, and I told my doctor, I'm having a lot of diarrhea, my family doctor, because my insurance was not allowing me to see my bariatric surgeon anymore. They were then out of network. They wouldn't let me see him. So I saw my primary care doctor, and she said, if it keeps up, we'll get you in with a GI doctor, get a colonoscopy. Well, at that time, I started speaking and traveling and was going somewhere once a month usually. And in February of 2022, I had a colonoscopy and they did biopsies. They called and told me everything was normal. So I just kept carrying on. I'm like, okay, well, I'm going 8 to 12 times a day. And I know this isn't normal, but they said everything's normal. So about 6 months went by. And in October of 2022, I started what I now know was a flare. And I was going to the bathroom at least 20 times a day, sometimes upwards of 50.
Wow.
it was starting to really interfere with my nursing job. I was a hospice nurse for 8 years. And so I called that GI doctor and I said, like, you've got to help me. Like, I don't know what's going on, but like, I have been at the ER twice for potassium, magnesium. And they called me back and said, you actually have collagenous colitis. We gave you the wrong result. And I was like, that's fine. Like, I just want to know what it is. Like, let's
just name it.
Yeah. And once I got a name on it, I was so excited. Like, I just wanted to know what was wrong. So I continued to see this GI doctor until Christmas time. And she said, look, you have lost 40 pounds in 2.5 months. You need a referral to Cleveland Clinic. We can't help you here. Like, it's too small of, it was just too small of an area. My insurance denied every referral up to Cleveland Clinic. And at that point, it was the end of January. I was 142 pounds, which is, I'm 182. Like, that is my good, happy, like where I feel good. And so I had to make the really hard decision to quit my nursing job as a hospice nurse because I was working in Depends. I was going to the bathroom in patients' rooms because I couldn't make it to the staff bathroom. I called the hospital ombudsman. I called every person at that hospital and tried to get help and told them what was going on. So I terminated employment and I got marketplace insurance, like the best plan I could get, so that I was able to go to Cleveland Clinic because I knew I needed to go to the gut rehabilitation center.
Wow.
And it was about that time that this is kind of where the story gets complicated. But I have a family member who knows a GI doctor. And so she got me in contact with him. And in February, I started talking with him and telling him, I mean, he spent a couple hours on the phone with me 2 different times. And he said, I can see you March 1st in the office. When I tell you, I counted down the minutes. At that point, I was 138 pounds. And I started to get a bed sore from just like laying in bed. He direct admitted me to the hospital and then he went on vacation after he did a colonoscopy and said that I had some ulcerations. And there was like a bunch of things going on, but he said he was going on vacation and it would be like his partner that was covering for him took over my case. I was in the hospital for 9 days and they said, you are not starving. We are not running any more labs. You are fine. Your weight is normal and you had bariatric surgery. So it has to be the reason why all this is happening. And I was like, okay, first of all, I'm not even worried about the reason now. They started me on tons of oral medications in October and they didn't do anything. I said, I just need nutrition. Like my feet were like duck feet. They were sunk in. So they discharged me from the hospital with a blood pressure of 74/38 and my heart rate in the high 30s. And I was trying to get a new primary care doctor at that time. I saw him 6 days later and he was very concerned. He's like, he's like, I'm going to be a good quarterback to man all this, but we need to like figure out what's going on. Every time I go to the ER, this GI doctor who my family member knew, his staff would call me and say like, why are you at the ER? You need to call us and we will get you like an infusion for fluids. And I said, listen, I don't need fluids. Like I can barely walk. So it was the morning of March 15th. I started hallucinating and was unable to walk. I called 911 and started screaming for my mom. And when they took me to the ER, my phosphorus was 1. They had never checked my phosphorus. And I couldn't even move my hands. I didn't know why. And that GI doctor's office called and said, 1, we could give you oral phosphorus for that. And I was like, no, that ship has sailed. It's like, I can't do oral things anymore. Like I can't even eat. So at that point I was admitted and they put a PICC line in and I was on TPN for 6 months. And they did an extended colonoscopy after and found out that I do have a type of Crohn's as well. And honestly, bariatric surgery, the only thing that could have probably caused, which I told them every time, was malnutrition. Like, I'm at risk for malnutrition because I had bypass. Like, and it was very unsettling because, the doctors were, and this is a big reason why I was off social media for a little bit. The doctors put in their note, she was a nurse, she's single, she's not married, and she has quit her job to advocate for patients that have had bariatric surgery. And I know that it's normal, like in an H&P, to put something kind of like that, but it was so irrelevant. And on top of like everything I was going through, I'm like, they think I'm like exaggerating this or making it like and I just need help. Like, I just need nutrition.
Wow. That is a lot. So I have a question. What is phosphorus? What is what is TPN? Like, can you break some of this down? All right,
Laura, we only have so many hours in the day. Okay. Off camera, I'll explain all this to you.
There's somebody listening who's thinking the same thing. Like, what is the significance of it being one?
Yeah.
What is it? The significance of it being one? What is the normal number? And then what is the TPN? And I guess that means if they did a PICC line, which I think is something that attaches to your body, right? So you can't leave the hospital. Were you in the hospital for 6 months?
No, I was in the hospital for 7 days because they had to, titrate, which means just find a good level for the TPN. But I did develop refeeding syndrome because I was so much so starving, so the normal phosphorus, I think, is 3.7 to like 5.2, and mine was 1.
Yeah.
I didn't really know the significance of phosphorus either. And I'm a nurse, but it was, I think it's a slow drop, but it was a year and a half of going to the bathroom constantly and 3 months of going 25 times a day.
And, we see this all the time on both sides of the spectrum, not your problem, but the point is someone comes in, as soon as they give a history of bariatric surgery, so many people put their hands up in the air, even in the medical profession, and say, oh, it's got to be the problem. I mean, we joke on our side that patient can be 6 years out from bariatric surgery, go in the ER, have a headache, have a tumor on a CAT scan, and they're going to ask twice, are you sure this isn't due to the bariatric surgery? Maybe we should call the bariatric surgeon. I'm exaggerating, but the point is so many times where other physicians don't know anything about it, but they want to quickly defer to that must be the cause of it. You had a disease in your colon primarily that is never touched because of bariatric surgery. Now, obviously you didn't know that. And because you had bypass, you do have some compromise of your ability to absorb, but the amount that you were eating or not eating for that matter, you were going to be severely malnourished no matter what. Laura, TPN stands for total parenteral nutrition. So basically, it's the best we can do to give someone nutrition intravenously, specifically with their macronutrients. They're getting protein, they're getting lipids or fats, they're getting carbohydrates, not just fluids with electrolytes. Gut nutrition's always the best. It's always the best. But if you have somebody that's not able to keep anything down, unless you put a feeding tube down, TPN is what we would do. And when she said she had refeeding syndrome, she was so malnourished that if you're not careful and all of a sudden you give them really good nutrition, their body reacts in a bad way. And that's simplifying it, but that is just an indicator of how malnourished she was when she started finally getting nutrition, through her veins.
Wow. And this, it's crazy that, so was it at the large clinic where this GI doctor was? Was that?
So it was a branch.
A branch.
It was a branch of it, but it's very close to main campus. And this is a pretty well-known, great, GI doctor. And I don't know if he just wasn't listening because I know that he didn't I really want to believe deep down, and I'm working through this with my trauma therapist, that there was no ill will, like that there was no ill will.
Yeah.
Nobody wants anything bad to happen to somebody, especially a physician. Like they care, they do. And I truly think that he didn't know how bad it was. Like and especially then his partner taking over my case. And I looked great. Like I had a banging bod. It was, I remember thinking like, this is the body I've always dreamed of, but I would rather be 338 pounds than feel like that.
Yeah.
But deep down, I knew it wasn't from bariatric surgery. I knew, I just knew it wasn't.
You know what's so interesting about this? There's a lot of stuff that is, but the thing that sticks out to me right off the bat is you told your story at the beginning of what made you decide to have bariatric surgery. And even before you got to this part, my first thought was, what a great advocate for herself she was. You had that aha moment where you're like, okay, I went to sit in that seat and like, I don't want this for me. I don't want this for my family. And I'm going to go on my own and seek out if I'm a candidate for bariatric surgery. That's the rarity, unfortunately. Many times patients or people have been told, you just need to eat right. This is all self-inflicted. This is not a disease. You know, you're probably eating fast food, all of this stuff. Part of what saved your life in the end with this second episode is you were an advocate for yourself. You were adamant, I'm not going to take no for an answer. I'm not going to take this as a reason. I'm going to continue to seek out help and find something. And, you know, we physicians, we make mistakes all the time. And I think you're right. I don't know this doctor. I don't know anything about them. I would like to think the same thing, that there was no ill will. But at the end of the day, there was still someone wasn't listening and somebody wasn't putting the pieces together. And it just like people can get fooled by a history of bariatric surgery and not look deep enough, you can get fooled by a person's social media presence, their personality, what they advocate for, and think, oh, well, maybe this is linked to this. You know, but the fact that you advocated for yourself both times is what got you to both places. And it's hard because you took the onus on yourself, where we see so many people who are begging for somebody to give them the right direction, just like you were begging for somebody to come up with the right diagnosis. Other people who are battling obesity are begging for someone to advocate for them or help them and give them some evidence that maybe this is a good option for me. And they trust their primary care doctor, and many times that's not the person that recommends it to them. Did you ever hear from your primary care doctor or other people? I mean, I can't imagine a billboard was all. You'd probably at least heard it discussed before about bariatric surgery.
Yeah. So my primary care doctor, I actually started, it was called, so I was on Victoza. Mm-hmm. They put me on those injections right before he mentioned bariatric surgery. And that was about a year before the baseball game where I actually decided, like, I'm going to do this. But I was so offended when he said that to me. Like, have you ever considered bariatric surgery? And I'm like, oh, me? Like, bariatric surgery? Like, and then I was like, okay, Maddie. Like, I remember I told my sister about it. And she's like, you know, it might be a really good thing. And she's a nurse too. And I remember telling my dad, and he's like, I think it sounds wonderful. If that is what you want to do, we will support you 1,000,000%. But my primary care doctor did bring it up, but I wasn't happy.
Yeah.
And even having your family be so supportive, that's also rare. You know, and y'all are so sweet to this doctor. Okay. Because I'm ready to throw him to the wolves. Okay. But we got Kentucky kind over here. That's what I call Dr. Smith. And then Maddie, you're so sweet. You're like, you know, I'm working through this. And I'm just like, what is wrong with this fool? But anyway, so I just feel like, you know, we put so much trust into doctors, right? And then especially when they're attached to these big names. And it's like super disappointing when it wasn't just once or twice or 3 times. It was several times that you kept having to repeat yourself. And I just feel like that's ridiculous. I do feel like there was a little bit of negligence, whether it was purposeful or not. And you had to suffer through that. I really commend you because some people have a disordered way of seeing themselves that are like, oh, well, I'm 138 pounds. So even if I am unhealthy, at least I have, I'm 138 pounds. The scale is more important than my health. And you did not say that. And I'm not sure, that's who you are as a person, the health background, but I can just see so many different personalities, this going very, very south. Because of them being so stuck on the scale. And like Eric said, I think that it's so important, like you did, advocate for yourself and continue to speak up. Because if you were just like, well, they say I'm okay, they know what they're doing, they see patients all the time, then, you did everything you could so your parents wouldn't have to bury you. And then you had to keep advocating yourself for the same reason. And now you look amazing. You look so happy and healthy.
Thank you so much. It was, that was one of probably the easiest things for me. And it's crazy because I have always wanted to be like, 135 pounds, a size 4. And honestly, it was a whole new perspective on just size and health. And when I would have to work myself up all day to go take a shower for 10 minutes because my feet hurt so bad and my fingers, I could barely move them. I was like, this is awful. And I remember when they told me, we're starting on the TPN nutrition, you're going to gain weight. And I said, good. I need 50 pounds and a cheeseburger. That's all I want. And that's about what I got. I did have, and this is not off topic at all, but I saw my bariatric surgeon last month, and she saw my weight was 182. And one of the first things she said was like, would you want to consider a GLP-1 to get you back down? And I'm like, down to what? I'm like, you were there. You saw me and I understand. I told her, I said, I get it. I understand, and I'm not counting that out forever. But as long as I'm under 200 pounds, I don't want to do anything. I just want to stay right here.
Maddie, can I ask you, did they ever put you, when that conversation was had with your bariatric surgeon, did they ever say anything like, let's look at your body composition? Yeah, your weight's at 181, but let's see what your muscle mass is. Let's see what your body fat percentage is.
Never.
Yeah. And I know we only got so much time, but it just blows my mind. We work so hard. And I just had a conversation with patients today because today was my clinic day. And I told them, maybe we create this problem because we call this weight loss surgery. We can't expect you not to focus on losing weight. But that is not the whole story. It is not the whole story, And people will get tired of me saying this because I say it all the time, but there's this statement out there that I won't say who says it, but most people will figure it out, that loves to say, most of the time for laughs, unfortunately, the scale doesn't lie. Then that's the biggest freaking lie you've ever been told in your life. It does lie because it doesn't tell you the whole truth, And I always tell my boys when they were little and they'd get in trouble and they'd come to me and tell me, all right, tell me what you did. And they'd sit there and they'd hunker down. But we'll work through it. You got to tell me the whole story. If you leave parts of the story out, you're lying to me, because that would put the fear of God in my boys when they're little, because lying is just such a terrible thing. And then they get old and they're like, they don't care. But, you'll figure that out, Laura. But my point is it's so misleading. There are people that are 135 pounds that have a ton of muscle mass and they're extremely healthy. If you were 140 pounds and you were you were high muscle mass, low body fat percentage, you would have felt drastically different. On the flip side, you can be 182 pounds and be very, very healthy, depending on what your body composition is. And there could be times that at some point in your life, you may be 182 pounds and say, you know what? I may want to lose weight, but more importantly, I may want to just change my body composition a little bit for the better. And we have to get away from this fixation on just pure pounds. You know, if that is one of my missions, that we somehow change the way we look. Yes, we want to lose weight, but it is not just about losing weight, you know, and all these people, they'll reach out and say, I've hit a stall. What should I do? And I'm like, well, how do you know that's a bad thing? Maybe you've gained muscle, lost fat, and you're breaking even. You know, there's so many reasons behind that. You know that as a nurse. But it just amazes me how many times in 2024 it's not looked at.
Yeah, and I would say, Maddie, because I mean, your shape is great. Your shape actually kind of reminds me of my shape. Like, we're built, you know, thicker when we're stronger. I've been going to the gym a lot for my wedding, and I have lost some weight, but I haven't lost any muscle, and I've been lifting very heavy. I've been on semaglutide for about 2.5 months now. And it's been a really slow shift, but it helps with like the food noise and stuff like that. It definitely helps with that. It helps me not go for, you know, the chocolate chip cookie and take my protein brownie instead. You know, it helps me with those things. But, you know, it was so important for me to build muscle. And I feel like when sure, she meant no harm, but when we're just looking at the number and we're not looking at body composition, you know, who knows if you really need that. And I would even dare to say that on that medication, because if you don't, I have to sometimes set, I do now easily, but in the beginning, I had to set a timer for my snacks to eat my meals, like in between, eat enough protein, because if you don't, then you forget, and then you'll lose your muscle on these medications. And so I'm on our GLP-1 program with POP, like I'm doing the whole mind, body, soul thing, you know, because no matter what tool you use, you know, you have to treat the whole person, mind, body, and soul. But I think you look amazing. I watch all your clothes hauls and all that stuff. I'm like, that's cute. I'm gonna order that for me. If it looks like that on her, it's gonna look good on me too.
Well, and that's one of the biggest things is I want people to know that they can be 182 pounds, dress their body confidently, comfortably. And that's something that I never got to do as like a teenager or in college because, you know, I was always morbidly obese. And I know that disease will stay with me forever, but I have a pretty good handle on how to control it for the time being. I know that things can change in an instant. You can, you know, need to add in something else to help. And I'm all about like adding in whatever assistance you need, like whatever tool can help is, you know, wonderful. And I did this summer, I went through the Berry Accountability Program that POP has. And it was actually the mental health Christina, who I adore. She was the one who mentioned about a trauma therapist. And I am so grateful, like, because it's helping me just even be able to talk about this. I couldn't talk about it for a long time. And so I'm very, very grateful for all the tools that I have in my toolkit.
Amazing.
Yeah, that's awesome.
Well, thank you so much, Maddie, for joining us. This has been such an amazing episode. Like, thank you for courageously sharing your story. And we just wish you all the great things. We're going to continue watching you advocate not only for bariatric patients, but I feel like you just advocate for living a healthy, happy life.
That's what it's all about. And if that's at 140 pounds, that's great. But right now it's at 182 and I have my muscle back. I'm able to jog, which is huge. And so things could not be going better now.
Well, Maddie, it's good seeing you again. You know, I've watched the recent events peripherally, and it's really cool to see how happy you are on all spectrums of life. So that makes me happy. Keep sharing your story. I think you hit the nail on the head at the very beginning when you said, you know, this has been hard, but you know, the good Lord put you through this because you're able to handle it and you're able to pass that message on to other people to give them hope. So there's a reason behind it. As you know, you don't need me to tell that. So just keep handling it the way you are, because you're changing so many people's lives, and giving them an opportunity to see that and know that no matter what you've been through, that first decision was such a positive life changer for you.
Thank you so much. And thank you both for having me. This has been great. This is the first podcast that I've ever been really nervous for.
Oh, well, no need to be nervous with us.
I was so nervous.
Well, it was good, right?
Yeah.
You had fun?
You did great.
Yeah, much fun.
Awesome. Thank you for joining us for this episode of Pop Culture Podcast, where you learned how to stay healthy, happy, and advocate for yourself. We'll see you next time.
See ya.